Good evening and welcome. Thanks for joining us as we celebrate the appointments of Dr. Adonis Hijaz, MD, as the Les Kapersky, MD, Professor of Urology, Dr. Nicole Maronian as the Julius Mccall, MD, Professor of Otolaryngology, Head and Neck Surgery, and Dr. James Voos, MD, as the Charles H. Herndon Professor of Orthopedics. Welcome also to the families of Dr. Hijaz, Maronian, and Voos who are joining us this evening, even if we're virtual, but we're excited to be able to pursue this. And we're glad to do it after a too long delay. Professorships remain very special for the School of Medicine because they bring together recognition from alums, friends of the school, donors to our remarkable Faculty of Medicine. Tonight we celebrate three highly accomplished Faculty of Medicine from the UH campus. Our endowed chairs are held by the CWRU Endowment, and all are approved by the CWRU Board of Directors and the President of the University, Eric Kaler. They honor our best and our brightest faculty, thank them for the contributions they have made and will continue to make to improve healthcare discovery, new therapeutic pathways, and to practice and teach their skills as clinicians to our students, residents, and their colleagues. Recognizing our best faculty inspires others. All of our chairholders will end up changing their signature page as of tomorrow, their email page, their business cards, their letterhead, to let others know in their publications and bring recognition to themselves and to our Faculty of Medicine and to the School of Medicine as well as university hospitals. Currently, the school has more than 120 endowed professorships, about 2/3 of them established in the last 12 years during the university's Forward Thinking campaign. So I have to give my hats off to all of our donors who've made this happen, both recently and historic. Many of the chairs this evening are quite historic. Their joy in establishing endowed professors and professorships is their way of giving back and ensuring the highest quality principles of our school continue is an attitude that I cherish, and I'm sure all of you do as well. Let me highlight one of our professorship namesakes this evening, Dr. Les Kapersky, and note that he himself was both a chair and as a junior fellow, Damon Runyon fellow at Harvard Medical School, and whose obituary, which I looked up recently, notes that he was one of the most published urologists of his time. So he too was highly regarded in his era. And I look forward to similar accolades for each of our recipients this evening. Since these professorships all recognize physicians from university hospitals, I would now like to introduce Dr. Dan Simon. Dr. Simon is the president of University Hospitals Health System Medical Centers and professor of medicine at the School of Medicine. He graduated summa cum laude from Harvard College, earned his MD degree from Harvard Medical School, completed his internal medicine residency and cardiovascular medicine fellowship at Brigham and Women's Hospital and interventional cardiology training at Beth Israel Hospital, all at Harvard Medical School. He joined the faculty of Brigham and Women's Hospital, where he rose to the rank of Associate Professor of Medicine before being recruited here. He's the recipient of a remarkable number of research awards, was elected to the American Society of Clinical Investigation, the Association of University Cardiologists, and the Association of American Physicians. He is the recipient of a prestigious Merit Award from the National Heart, Lung, and Blood Institute, and in 2016 was recognized as a distinguished scientist by the American College of Cardiology. He's a fellow of the American College of Cardiology, the American Heart Association, and the Society of Cardiac Angiography and Intervention. Dr. Simon's major area of research is on the role of inflammation in vascular injury and repair. His research, as you've heard, is supported by many grants from the NIH, the Prentice Foundation, Medtronic Foundation, and Discovery Institute, And using cutting-edge transcriptional profiles approaches, his laboratory has identified a novel marker that predicts the risk of future heart attack and stroke. He continues to publish in very high-impact science and clinical journals. And with those inventions, he is the co-founder of Udana Biotech, a startup biotech company that's developing novel monoclonal antibodies for these inflammatory and vascular disorders with lead compounds that are in preclinical development. As an active interventional cardiologist, he plays a leading role in international clinical trials for new devices, antithrombotic agents, and regenerative medicine therapies. Locally, he's also known as the cardiovascular healthcare provider for the Cleveland Browns, and he serves on the editorial boards of Circulation, Journal of the American College of Cardiology, and recently appointed to the editorial board of JAMA Cardiology. He also serves on local boards of directors for Playhouse Square, University Circle, and the Cleveland Institute of Art. Without further ado, and after that long introduction, I introduce Dr. Dan Simon.
Thank you, Dean Gerson, for including me tonight. It's truly an honor and a privilege to celebrate the achievements of Dr. Hijaz, Maronian, and Voos. Throughout our history, UH has always strived to improve the state of medicine and the well-being of our families, friends, and community. And we've been successful in part because of our commitment to pioneering medical research and breakthroughs. There are many forces driving healthcare transformation at an accelerated pace, but these changes also provide us with incredible opportunities, especially as it enables us to distinguish our translational and clinical discovery, not only for UH, but for Cleveland as a whole. Our goal is to accelerate discovery, innovation, and translation of scientific breakthroughs, which address unmet clinical and social needs to enhance the lives of our patients, our community, and the world. We strive to improve healthcare outcomes with evidence-based practices and give hope to patients who believe they have exhausted all options. We want to attract new patients seeking cutting-edge care with new drugs, devices, and cell therapies. And new discovery also helps produce intellectual property, which can be monetized for sustainability. However, the backbone for all of these aspirational goals is the people. And as Stan mentioned, these endowed professorships are vitally important in helping us to recruit, retain, and support the finest physicians for our community's benefit. These positions represent prestige, leadership, and great responsibility for those who hold them. While each of our honorees tonight will have more detailed introductions in just a bit, I want to point out that these three physicians have distinguished themselves by demonstrating an unusual depth of knowledge in their field, displaying a proven ability to provide compassionate, appropriate, and effective care to all patients, exhibiting a willingness to acquire and share new knowledge, expressing outstanding interpersonal skills, illustrating a commitment to professionalism, and clearly demonstrating a track record for teaching and inspiring students, residents, and fellows. It was once said, a leader is one who knows the way, goes the way, and shows the way. Congratulations, Adonis, Nicole, and James. The three of you are exemplary physicians who know the way, setting high benchmarks in your respective departments because of your expertise. You also go the way because you are constantly emulated by medical students, residents, and fellows, and you relentlessly show the way in setting standards for quality, making improvements in patient care practices, and offering your patients the most advanced care and caring. Thank you for all that you have brought to UH and to CWRU and to our greater Northeast community of Ohio. I am proud of all three of you. And back to you, Stan.
Thank you, Dan. I now have the honor of introducing our first professorship recognition by introducing Dr. Lee Ponsky. Dr. Ponsky received his BA from the University of Rochester and his MD from Case Western Reserve University School of Medicine. He then trained at the Cleveland Clinic, including a research fellowship in urologic oncology and an advanced urologic laparoscopic and endourology. In 2005, he joined the Faculty of Medicine at University Hospitals, where he was also, I would point out, a K-12 scholar in the Cancer Center and had a delightful time of being trained in clinical research, and is now chair of the Department of Urology and director of the UH Urology Institute. He is a School of Medicine professor and holds the Leo and Charlotte Goldberg Chair in Advanced Surgical Therapies, and is a master clinician in urologic oncology. He has over 130 publications, is widely sought after for national and international conferences, including a number of very prominent CME activities. He's a co-principal investigator of a recently awarded NIH R01 grant, which I hope you hear a little bit more about this evening. He is the editor-in-chief of a textbook on robotic radiosurgery and recently founded Walden Medical, a medical device company. Not having any spare time, he also has received numerous accolades for his role as a founder of MedWish International in 1993, a nonprofit organization that saves lives and the environment by repurposing discarded medical supplies and equipment that provides humanitarian aid in many developing countries. He also serves as a founding board member of the nonprofit MedWorks, which provides free health care to the uninsured and underinsured. These efforts have been recognized with awards from the Manhattan Institute in New York and with the Richard Cornuel Award for Social Entrepreneurship, and by Smart Business as the Nonprofit Board Executive of the Year. Back to his scholarly work, Lee received the University Hospitals Case Medical Center Urology Institute Faculty Teaching Award for efforts with student and resident teaching. Ladies and gentlemen, it is my sincere pleasure to introduce Dr. Lee Ponsky.
Thanks, Stan, and congratulations to Nicole and James and Adonis. You know, we have opportunities, which often seem too infrequent, to stop and recognize people for outstanding accomplishments. And I think this one is extra special because not only are we acknowledging and recognizing the accomplishments of these individuals for their careers, but it's fun to see close friends receive these acknowledgments. So to you all, really well-deserved congratulations. Now let me talk about Adonis Hijaz. Adonis was born in Lebanon. He did his training at the American University of Beirut. For those who don't know, in the urologic field and probably many other, it's one of the most competitive places to get in and train. He trained in urology, did his residency, and then went on to do a fellowship with Dr. Hirschhorn, I believe was in Toronto, and then made his way to Cleveland. And he was at the Cleveland Clinic where I was doing my residency and fellowship, and I would see him sitting in this office, and he was always sitting behind a computer. I didn't really know what this guy was doing, but apparently he was writing a lot of papers and doing some pretty elegant research. And when I was coming over to join the faculty at Case Western and at University Hospitals, I said to this guy who was doing a fellowship in female urology, why don't you come join me? We can be partners in crime. Well, I didn't know at that time, would this guy not only become my lifetime partner in crime, my partner in the department and helping build something really special, but he's also been a mentor and a teacher to me in what academic medicine really means. Adonis came to university and had a K-08. He had to educate me about NIH funding and the importance of it, and the importance of elegant research and what it means to truly be a surgeon scientist. And I really describe Adonis as really a true surgeon scientist. He then went on to get a K20 to an R21, and now has recently been recognized not only with a recent R01, but an AHRQ award. This is really the highest levels of recognition in the academic area. He is widely published, widely recognized on not only NIH review sessions and committees, but a sought after visiting professor, both nationally and internationally. He was recently recognized by the American Board of Urology for not only having not trained in the United States, but to allow him to seek board certification through the American Board of Urology because of his exceptional accomplishments. And this is a very rare acknowledgement by a board that very rarely does that. Within our own backyard, he was recently acknowledged as a distinguished physician, which really defines Adonis as the physician's physician. And this is one of the highest recognitions you can receive at university hospitals. But let me tell you, all of that is wonderful. And he has taught our residents and fellows how to teach and how to ask questions and how to publish. When I became chair of the department, Adonis and I worked together to develop something that we trademarked the name, the Parallel Paths, to allow people who have ideas to develop their ideas and publish them. And with that, and with Adonis's leadership, we were able to triple the department's publications, triple our grants submitted, and triple our grants that have been awarded. This is an outstanding individual, not only academically, but personally. I want to specifically call out Adonis's family, both here in the US and in Lebanon, who are with us watching tonight. I know how much his mother and uncle mean to him, and his father, who is no longer with us, is a big part in Adonis's heart. His family is utmost important to him. This is an outstanding individual who not only is my business partner, my vice chair of the department, but also my close friend. Brother, congratulations. I couldn't be more proud of you. And this is the most well-deserved recognition. We're very proud of you. Congratulations.
Thank you, Lee. And I'm going to share my screen, and I'd like to start by saying thank you, Lee, for this kind introduction. And I would also want to thank Dr. Gerson, Majerion, Dr. Simon, and fellow honoree and colleagues and friends. I'm honored to be the recipient of the Lester Persky Professor of Urology. And over the next 10 minutes, I would like to pay tribute to Lester Persky himself and to the many people who have shaped who I am and influenced my journey so far. Dr. Gerson described Dr. Persky as one of the most accomplished urologists at his time, and he established the program at University Hospital and Case Western Reserve University, and he was known to train the trainee. He has trained many urologists who became the leaders in the field within the United States. But I was talking to one of my colleagues, Dr. Michael Barkrukas, who trained in our program, and he's one of the senior colleagues of mine. And I told him, so tell me about Lester Persky, a few things that I need to know. And obviously, two facts fun facts that we need to know about Lester Persky is his morning rounds. Usually morning rounds start at 4:30, and so the residents don't complain. He would invite the residents and buy their breakfast, and they would choose the breakfast for him. But admittedly, he was never happy with what they choose for him. He was also famous for saying that every other night is not enough because you will miss half of the cases that come on as emergency cases. That wouldn't fly during these eras of current training. But according to Michael, he said he pretended to be gruff on the outside, but he was a teddy bear on the inside. And when I talked to Michael about Dr. Persky, I don't know him personally, you could see how much admiration he had to his mentor at one point. And that's a legacy that I would love to keep at this university hospital and Case Western and promote going forward. So where did I come from? I was born in this small village in the mountains of Lebanon. I'm putting the cursor on this house that was a house of my grandparents in the Bekaa Valley in Lebanon. That's where my dad was from. My dad and my mom immigrated to Liberia, Monrovia, and this is in Monrovia is the place where I was born, together with my older sister Elisar and my late brother Dureid. My dad passed away when I was young, and this is a picture of me and my dad. I think I was 5 years old or something like that. He passed away when I was 10, but God gave me the opportunity to have two people who are amazing in my life: my mom and my uncle, who are my rocks. They are two individuals who raised us with love and instilled in us all the values that made us who we are currently. I know that they're watching, and I'll tell them this is for them, and I love them. I grew up in Beirut. This is a picture of the city of Beirut. I think we lived in one of these buildings in the crowded city of Beirut during the Civil War. Was the days when we were going to school, but we were protected by a loving, caring family. Next to the city of Beirut is a picture of my siblings, and next to me is Elisar, my older sister, and Mariana, my middle sister. Elisar lives in Edmonton, Alberta. Mariana lives in Michigan, and she's a GYN oncologist. And my little sister, Diana, who flew from California to be with us today, she's a software engineer and works for Tesla. I know that Mariana and Elisar are watching, and I send them my love. I went to training, as Lee said, at the American University of Beirut on the coast of the Mediterranean. This is the beautiful campus of AUB. I did my undergrad there and medical school, and then I did my urology training there under the leadership of Dr. Khawli and Dr. Bulbul and Dr. Wazan. And not pictured here is the late Dr. Hamadi. Dr. Hamadi was the professor of surgery, and he was the chairman of the surgery department. He was a urologist. He had played a major role in convincing me to go into urology and showing me the ropes of urology. These people have a huge impact in who I am as a surgeon, as a urologist. But then my journey continued to North America. As Lee said, I spent a year in Toronto with Dr. Sander Hirschon. He did a fellowship in neurourology, urodynamics. That opened my eyes to female pelvic medicine and reconstructive surgery, a field that I didn't have any experience with as a resident because we didn't have that in our training. So I came to Cleveland, where I spent a couple of years where I got to know Lee at the Cleveland Clinic, did the fellowship with Raymond Brackley, Sandip, Firuz, and Mark Walters. All these are the surgeons who taught me the skills of female pelvic medicine, and I owe these guys what I know and what I have been able to give my residents and my fellows. But it's truly in Cleveland where I got bitten by the bug for research. Cleveland changed my focus, and I wanted to continue my path as a surgeon scientist. I got to know Margot Damiser and her work. I wanted to evaluate urinary incontinence model, and I learned about vaginal birth injury and the models of vaginal birth injury. And we worked with Margot and Firuz in creating models for sling incontinence in rats. And during this period of time, at the end of my fellowship, I got to admire the work that Mark Penn did on cardiology and cardiac injury with the stem cell therapy, as well as chemokine therapy for treatment of heart problems. And I said, why don't we translate that work and apply it in the urology incontinence field? And that's what started my journey for research. Obviously, I will fast forward. In 2010, I was, like Lee mentioned, lucky to receive the Career Development Award for the NIH. And I was more lucky to have Dr. Arnold Kaplan be my primary mentor on my award. Ardon Kaplan is well known at the university campus as the father of mesenchymal stem cell. He mentored me. He would spend hours with me on a monthly basis discussing what he liked to say called the logic of mesenchymal stem cell therapy. This is a busy slide, but it's actually describes the areas where I spent my research over the last 15 years. Initially, we worked with the animal models for incontinence and evaluated childbirth-related trauma. The purpose of that is to learn from that trauma to identify mechanisms of injury so that we harness some of these mechanisms and the knowledge to use it back in preventing injury. And part of that work that we've done, we identified a couple of chemokines that we were able to work with biomedical engineering to develop chemokine releasing gels to release these chemokines on a chronic basis. Obviously, in addition to the work on prevention, we were also focusing on delivering stem cell in the treatment of urinary incontinence. This is all in preclinical models. And the premise was, if we are going to treat a chronic disease disorder, we will need not only to deliver the stem cells, but we need to activate them. And for that reason, we came up with this proposal. This picture here in this slide summarizes one of the concepts for an R01, which is going to be resubmitted. And I promised Dr. Kaplan that one day that work will translate to an R01. But during this period of time, as we were developing this, I would call it futuristic treatment for urinary incontinence, something happened at the FDA level. So in 2008 and 2011, the FDA released warning about the use of mesh in pelvic floor surgery. And with that, in our backyard at Case Western came this brilliant researcher and scientist to my office. And he was in my office telling me that, Adonis, I have this technology where I can take collagen solution and electrocompact it and make threads out of it. And we were talking, this is 2014 at the peak of the mesh era. And I said, Ozan, can we make mesh out of this? He said, why not? We can weave it, we can stamp it, we can make whatever you want. And we started that research collaboration that a few years later resulted in funding from Ohio Third Frontier, as well as University Hospital Startup Innovation Fund, which allowed us to develop this technology into a large scale platform that we implanted in sheep. And to our surprise, we harvested this material a year later, and we found that collagen material was still there after a year. So that became the foundation for the collar mesh or collar sling. And part of this work resulted in the formation of a startup company, a spinoff of Case Western called Collamedics, which I'm part of. And Collamedics, over the last 3 years, with the leadership of Donna Richardson and Suba Shankar, as well as Ozan, was able to raise $3.4 million in NIH funding and NSF funding. And hopefully we're looking into a design freeze in the next year. And within 2 years, we will go into clinical trial. So we're pretty excited. I think we're writing the next chapter in the pelvic floor reconstruction, and this is starting here. Finally, and before I conclude, over the last 2 years, I had the privilege of working with Lee, and we working, as Lee mentioned, on rebuilding the research infrastructure for the department. We got granted an R01 and an ARC grant, and we're developing the parallel path that Lee talked about. But most importantly, you come back to the essence of what we too is coming back to a beautiful family. My wife and I was blessed to have a newborn. Carolina Masri used to work alongside Lee at MedWish as the executive director for MedWish. So as of a few days ago, she's decided to stay home with our little baby Zayn and help us raise these beautiful kids of mine, Sarah, Celine, and Jad, as well as Zayn. And this is my life. This is a place where I love to be. And finally, hopefully one day I'll go back to this beautiful village in Lebanon where I can retire in the house where my parents came from. Thank you very much for the honor.
Thank you very much for a wonderful presentation, Dr. Hijaz. Truly meaningful and transformative, and we greatly appreciate it. For our second professorship, it is my distinct honor to introduce Dr. Cliff Majerion, a head and neck surgeon par excellence and Chief Executive Officer of University Hospitals, position he's held since February 2021. Prior to that, he served as the health systems president, a position he was appointed to in December 2019. Previously, Dr. Majerion served as president of University Hospitals Physician Network and System Institutes, and before that, president of University Hospitals Physician Services. While maintaining an incredible academic posture, he has raised physician productivity to its highest level and significantly increased physician engagement. Dr. Majerion is a graduate of the University of Michigan Medical School and completed a residency in otolaryngology here at University Hospitals and Case Western Reserve. He then completed a research and clinical fellowship in otology and neuro-otology at Harvard Medical School at the Mass Eye and Ear Infirmary. Prior to joining UH in 2002, Dr. Majerion served as the physician at the Louis Stokes Cleveland Veterans Affairs Medical Center, Metro Health, and Boston Medical Center. He's also worked at the University of Massachusetts Medical Center, where he served as the director of the residency program and physician and unit chief of the Department of Audiology, medical director of cochlear implant program, and co-director of the Center of Skull-Based Diseases. He was also the director of otology and neurotology in the Department of Otolaryngology. His clinical career has been devoted to the management of hearing loss, chronic ear disease, osteosclerosis, vertigo, and other otology and neurotology issues. He's published over 120 peer-reviewed manuscripts and abstracts, served as a visiting professor across the country, and has a particular research interest in Meniere's disease, which has been funded by the NIH. As a surgeon, Dr. Majerion co-founded UH's cochlear implant program, and he and his team have performed over 1,000 cochlear implant surgeries, making it one of the largest in the country. To introduce our second professorship, I now would like to introduce Dr. Cliff Majerion.
Thank you, Dean Gerson. I want to just, before I get into talking a little bit about Dr. Maronian and the Julius Mccall professorship, I just want to give thanks to you and your leadership and that of Eric Kaler and before him interim president Scott Cowan in terms of your commitment to make sure that the professorships that we're endowing today are happen and that they're done in this very lovely way. I think that honors both those who are receiving it, the chairs and the leaders of those clinicians, and most importantly, the folks whose namesakes have become these professorships. Briefly, before I talk about Dr. Maronian, I think it is important, as you did allude, to the history of the Lester Persky professorship. Similarly, Julius Mccall was the leading head and neck cancer surgeon in the Cleveland area in the 40s and 50s and 60s. Unfortunately, he and his wife, who had no children, were beset with cancer, and him and his wife turned over his care to senior oncologists at university hospitals back when it was the Ireland Cancer Center. And they took care of him, but ultimately, upon passing, his wish was that, and this was before 1985, his wish was that he would be able to endow a professorship at Case such that the Case could encourage the creation of a department of otolaryngology at university hospitals under the auspices of the academic oversight of Case. In other words, before 1985 and before, there was no department. It was a division of surgery. And with his gift and with his vision and the leadership, I think at the time of Neil Cherniak, who is the dean, they made the decision in concert with university hospitals to establish and create a department. And they were able to then offer the recruited chair the Julius Mccall Professorship. And that so happened to be in 1985, Dr. Anthony Maniglia from University of Miami, who established the department, and he held the professorship until 2000, when he retired, and Dr. James Arnold was fortunate enough to then be bestowed with this professorship. And then he ultimately had a fantastic career and retired, and it just so happens that I was then selected by, at the time, Dean Davis and Fred Rothstein to become the chair at University Hospitals in 2012, and was appointed the Julius Mccall. So it just seems fitting that we are now able to now have the fourth recipient and be able to fulfill, I think, the original vision of the Mccall family to make sure that we have longevity and a future. I don't think there's a better person ever to maybe hold the Julius Mccall chair professorship, I correct myself, than Dr. Nicole Maronian. Dr. Nicole Maronian is an incredible clinician who, after training at University of Rochester in her residency, went on to do her fellowship at University of Washington in laryngology, at the time in Yulee of all field. But interestingly and serendipitously, it corresponded with the vision of Dr. Mccall. Dr. Mccall became troubled very greatly in his career by the travails of a patient who suffered from laryngeal cancer and either couldn't speak because one of their vocal cords were removed, or, as many of you don't know, but certainly Dr. Maronian knows, the operation of the day was what was called a laryngectomy, the removal of one's vocal cords. And he championed, first in Cleveland, starting the Lost Chord Club. The Lost Chord Club was a group of patients and scientists devoted to developing alternatives to vocal cord related speech, but using what was called esophageal speech, which then later led to procedures which routed air from the esophagus to the stoma, which everyone wore. In other words, his whole scientific and clinical goals were to improve speech in cancer patients and those suffering from other vocal cord problems, and hence the Lost Chord Club. Well, Dr. Maronian's entire career, after training as a fellow under Dr. Hillel at University of Washington, has been about enhancing and mitigating not just cancer-related vocal cord problems. Through her extensive research, she's learned how to use botulinum toxin for debilitating disorders such as spasmodic dysphonia, and using other interventions, and for example, respiratory papillomatosis, where we have HPV-related lesions which render people voiceless, but using antivirals directly injected to be an alternative to the old operations of essentially ripping them out but having to redo it a month later. Her CV is replete with tremendous contributions, and she's now a national leader, and probably out of me, James Arnold, and Anthony Maniglia, probably the best person, if Dr. Mccall was alive today, to hold the Mccall Professorship, as that's what he dreamed of. But her accomplishments at UH go far beyond her clinical. She was chosen after a fairly competitive chair search to become the chairman of otolaryngology, chairwoman of otolaryngology. And under her leadership, the department has grown much beyond I ever envisioned, frankly, in my time as a chair. I never dreamed that we could be populating every hospital around our now 23 hospital system with specialists. I never dreamed that we could build out bench strength in the divisions more than one or two folks. She's now grown almost every division to having multiple experts, which now are collaborating on research. The productivity in the basic scientists has improved. In other words, Nicole has been a fantastic chairperson, but she doesn't just stop. She's much like, if you will, what I've heard about Lee Ponsky. She doesn't stop there. She's been recognized by the leadership of university hospitals to take on many additional roles that she somehow finds time for. In addition to being one of the finest mothers and wives I have ever come to know, with her 4 amazing children and her fantastic husband, who also is a busy surgeon, and she has to balance all of these things that she does with the duties of managing this household. I've come to feel that Nicole is my younger, smarter, wiser sister in my life, who I rely upon, even in my role as CEO, as being counsel, as being an ear, as being someone who always will give me advice that's unvarnished. And I think many people through this organization have seen her rise to the level of being one of the folks who demonstrate the highest level of judgment, character, and as is with everyone who's being honored today with a professorship, the level of concern for her patients that ideally we all want, that is, she treats her patients like their family. And so it is very, very enjoyable, and frankly, I owe the Dean Gerson and President Kaler a tremendous amount of thanks and gratitude in my role as CEO of doing what you're doing tonight, and you've been doing with other professorships, and honoring the folks, and certainly my team at University Hospitals. And so with that, I'd like to turn it over to Dr. Maronian, and congratulations, Nicole. This is a fabulous, fabulous honor that you very well deserve.
Thank you, both of you, for those very kind words and for the opportunity to accept the Julius Mccall Professorship on behalf of our Department of Otolaryngology, Head and Neck Surgery. Congratulations to Adonis and to James and their departments, as well, as these are really shared and celebrated across university hospitals and the School of Medicine. I have to say, for an introvert, these talks are never easy. It's much easier for me to talk about something else, but not myself. But I always appreciate the opportunity to talk about the people, the circumstance, and the luck that has allowed me to be in the position with this professorship today. It did start, and I want to recognize my parents, Hovanes and Ermtraut, who are on the call today. And my dad is Armenian and was raised in Cairo, and ultimately met my mom there in the early 60s. She was German, and ultimately they got married, moved to Germany, where they had my sister Annette and myself. My dad completed his general surgery training there after leaving Egypt. And then ultimately, like many families in the early 70s, we transitioned to the United States, where my sister Michelle joined us, and then several Great Danes. You can see one of them there. But I have to really credit my parents for their incredible focus on hard work, on making sure that we valued education, and that we always identify ourselves as first-generation Americans, which has been a big piece of my upbringing and my career. My dad ultimately worked as a general surgeon in a community hospital in Rochester, New York for 40 years, and he served there as the general surgeon, the orthopedist, the internist, and had legions of very devoted patients and it was really from him that I learned that you really take care of patients as family. We all ended up following in my dad's footsteps. And so me along this medical path, my sister Annette initially as a physical therapist and then ultimately as a PhD. And now she's the director of admissions at Temple University's Doctor of Physical Therapy program. Michelle, who is a senior oncology physician assistant, specializing in solid tumor management. And all of us have really enjoyed this pathway into medicine, which was really spurred by my dad. But I have to recognize my mom because she was the glue that really made it all work. So thank you to you both. As Cliff mentioned, I started really at the University of Rochester, and at the time I was a categorical general surgery resident. In that class of 7, 5 of us were women, and it was considered to be an abject failure of recruitment that 5 women made it into a general surgery program. But we all finished, not all of us in general surgery, myself included. I ultimately spent 2 years in the lab and transitioned to ENT, but did get to know Cy Schwartz, who's wrote the big yellow book, The Principles of Surgery, and was able to maintain a long-term relationship with Cy. And he had an unbelievable knack of maintaining contact with any resident that he trained. He was the ultimate social networker in the era before social networking happened, particularly with digital media that we have as we know it today. But he unfortunately passed away last year at the age of 92, still going to work any day that he could. And we're fortunate, Tim and I, to attend his memorial service this past weekend. Arthur Henger was the chair of ENT at the time that I was there. He held that position for 27 years, which I find hard to imagine at this point now. But he was a particularly dynamic chair and really focused his residents on wellness, something that was not talked about at that time and anywhere in medicine. And it was something that was a real guiding force for me as I moved on through the years and as we continue now to talk to our residents about and faculty about on a much more regular basis. I moved on to the University of Washington and I started a fellowship there. I was the third fellow in laryngology, and this was a very new specialty area at the time. There have now been 20 plus fellows since that time, but it was a very exciting time in laryngology. And I was fortunate to work with Al Halal, who's been a lifelong mentor for me in the field of neurolaryngology. And Al is really the grandfather of that specialty in many people's minds. And Al also really focused on the importance of treating your patients with compassionate care, which was something, again, that was new at the time, but so critically important as I moved through the rest of my career. Neil Fucharan was a colleague, but now is the chair of that department. And Neil really helped me to focus my academic work and encouraged me for the first time to become a program director, which I am eternally grateful for. And ultimately at the University of Washington, after finishing my fellowship, being junior faculty, I became program director and a division chief there, and then transitioned here when Jim Arnold asked that I come and start the first Voice and Swallowing Center here at University Hospitals. And I'm really fortunate that both Jim and Cliff are on the call, 2 prior Mccall chairs. Jim really did what University Hospitals does incredibly well, which is say, take it and run with it and show us what you want to do. And I have been able to evolve that now to expand the division, include speech language pathology in ENT, have it, hand over the division to Scott Howard. And we're hiring another laryngologist. So it's been a really tremendous journey here. Jim also was kind enough to share the residency program with me, and that was my second stint into the program directorship. And I'm so grateful, and Jim was just here visiting us about a month ago, for all of your mentorship. So thank you, Jim. Cliff really was that person, the first person that I really met at UH, the person that took me around, introduced me, and also opened up so many doors and opportunities for different committees, programs, positions, and has been just an incredible supporter and mentor through all the twists and turns of this career. So thank you very, very much, Cliff. If I think about laryngology, which is really the study of the voice, swallowing, and airway, it is one of the most fascinating areas of the body because all of these functions have to happen very quickly, exquisitely timed, and with tremendous neuromuscular control. And so neurolaryngology is really where my base is, where my comfort level is, and the area that I find the most interesting. At the time with starting this, and I've just put out a couple of things here, although neurolaryngology was the big focus, and the area really involved utilizing EMG and fine wire EMG to understand all the fine motor coordination of the larynx. And so we put wires and electrodes in so many different areas to understand all of that coordination. And we're able to write fairly extensively on mapping out that multiple muscle involvement that is still utilized today and guides Botox therapy today, which is a significant component of my practice. Reflux was the other area, and we were really able to partner with the Department of Surgery there in establishing reflux and its role in the larynx, looking at its impact on airway disease, subglottic stenosis, lesions, and multiple other areas involving the voice. At that time, reflux was everything. Now reflux is not as prominent anymore in laryngology, and I'm actually quite thankful for that. In my transition here to university hospitals, I really became involved in management of the precarious airway, which means that patients that have difficulty breathing, either because of vocal cord issues where they're not moving well, tracheal issues, or just basic anatomy that makes them difficult to intubate, really was a strong focus for me. And I was able to work on looking at novel ways of ventilation using jet ventilation and reconstruction strategies that evolved from endoscopic to complex reconstruction of very difficult tracheal malformations utilizing ear cartilage and the like, or free flaps. And that's been a very gratifying component of my career because so many patients were able to lose their need to use a tracheotomy tube and resume much more normal life and function. And one of my patients was incredibly happy to take that tube out because that meant they could then smell again. They were utilizing their normal airway, and he was very incredibly happy to be able to smell his mother's tacos. Now that administrative work has taken on a bigger role, I've moved more into value and quality. These have involved establishing care pathways around a multitude of things in ENT, whether it be epistaxis or whether it be facial trauma, whether it be looking at our how we utilize our order sets, how we discharge patients in a very busy hospital by noon. And all of those have really been focused on establishing our university hospitals ENT as the very best value-based care that ENT can provide in the nation. Our multidisciplinary team now is Scott Howard as division chief, and our speech pathology team, and our very incredibly talented clinical research fellow, Claudia Cabrera, has really helped us to expand these research interests. Dysphagia is the area that we're branching off into at this time due to the increasing prevalence of dysphagia in our community and increasing elderly the increasing elderly population. Our recent article on dysphagia management is being highlighted this month in Laryngoscope as the spotlight article. So we're very excited to highlight that for our research team. They also recently published a paper called 21 for 2021, and that's the most influential papers in laryngology since 2000. I was very happy that two of the papers I was involved in were able to make this list, and so it's nice to be able to see that the things you're doing do have impact in terms of this newer specialty of laryngology. I think one of the other major career directions for me has been in residency training. And as I mentioned, I've been the program director twice. Some would say perhaps now I am a recovering program director, although I don't know that you ever recover from that. It's sort of ingrained in your DNA, and it's a piece of my career that I have loved and continue to enjoy. We're very fortunate here to have such a strong partnership with an incredibly talented group of medical students at the school. We currently have 50 medical students involved in research in otolaryngology. That is more faculty that I have and more residents that I have, but the medical students come because of the quality of the research experience. And you can see on the right what has happened with our publications over the last 3 years, increasing by almost 200%. I have worked hard to foster the ENT Research Center with statistics support, grant writing support, database support, so that we can, across the spectrum of all of our divisions, really showcase our national expertise through research. Sponsorship and mentorship has also been very important. And so I've been fortunate to also sponsor other program directors across the country. Tanya Meyer was a medical student when I was a resident and now has taken on that role of the residency program at University of Washington. Marita Tang was a fellow that I was fortunate to work with and is one of the most longstanding program directors in the country. And Sarah Maury, we were so fortunate to recruit here to University Hospitals and has taken on the residency program and has done an incredible job of escalating it to the next level with her passion, expertise, and care. The McCall Chair for our department has been an incredible grounding force. I'm sitting here at Anthony Maniglia's desk. It's about as large as a dining room table, but it's still here. And as the founding original recipient of the McCall Chair, he really set that tone. It was important that this chair remains important for us because it allows us to pay back by training the next generation of ENT surgeons. It helps us to continue to grow this department. And as Cliff mentioned, we've hired 11 otolaryngologists in the last 15 months. It helps us to foster our national reputation as a leader in ENT research, particularly to support our PhD researchers in the hearing sciences. Our group of 5 dedicated PhD researchers have continued to be very prolific, and we have an upcoming, I'm excited about an upcoming publication that will be announced shortly in Science from this group. We are continuing to expand research and innovation around clinical trials, and we have 4 new clinical trials just in the last year, again, in our hearing sciences area. And our ultimate goal, and what this chair really helps us to accomplish, is to provide the very highest quality of ENT care anywhere in the country. I couldn't do this without the support. I'm having glitchiness here, sorry, of my family. And so they are pictured here. I thank particularly my parents and my sisters who are on the call today. Connor and Delaney are the youngest of the kids. Delaney's in 8th grade, Connor in 9th. Devin, who's in the upper right corner, is our chef and sommelier and makes all parties better. Sean in the bottom right corner with his fiancee Mallory is in New York and works as an actuary. And Tim, who is my partner, my North Star, most talented surgeon I know. And I thank him very much for everything he does to make this all possible. So thank you very much for the opportunity to hold this chair for our department. It is incredibly impactful, and thank you, Dean Gerson, for this opportunity.
Thank you very much, Dr. Maronian. That was a spirited and very personal presentation, which I greatly appreciate. And you're correct. Each of these professorships is like a fine watch, which you never quite own, but you take good care of. And thank you. So to continue our star-studded lineup, I'm very eager to introduce Dr. Randy Marcus, a stellar fixture in this medical center for decades. Dr. Marcus is professor of orthopedic surgery in the Department of Orthopedics at our school and is attending surgeon at University Hospitals Cleveland Medical Center. Dr. Marcus served as the previous Charles H. Herndon Professor and Chairman of the department from 2003 to 2018. And during that time, Dr. Marcus expanded the department with the addition of 30 surgeons and physicians, as well as 5 basic scientists. He added 8 new practice locations, markedly increased the endowment of the department with the addition of 9 new endowed chairs and 5 endowed lectureships. During his entire tenure as chair of orthopedics, the department was ranked by U.S. News and World Report in the top 50 departments in the country, and by the NIH in the top 10 for research funding, quite an accomplishment. Dr. Marcus is an internationally recognized expert in the area of lower extremity reconstruction and trauma surgery, subspecializing in hip replacement, knee replacement, ankle and foot surgery. He's a member of numerous national and international orthopedic societies and was elected president of both the American Board of Orthopedic Surgery and the Association of Bone and Joint Surgeons. He's an associate editor and chairman of the Board of Trustees of Clinical Orthopedics and Related Research. He also serves as a board member of the Association of Bone and Joint Surgeons and is on the medical advisory panel for the National Red Cross and Blue Shield Association. Dr. Marcus has participated in research funded by the National Institutes of Health with over $7 million of research effort, has a number of US awarded patents, and many of which have been licensed, has 93 publications, edited 2 books in orthopedic surgery, and has been visiting professor with over 270 invited presentations. I think after this evening's earlier events, you'd actually like to hear even more about the Charles H. Herndon Professorship. Again, I reviewed that in the last couple of days. It is truly remarkable. And it's now my pleasure to introduce Dr. Rainey Marcus, who will continue the tradition of handing off this professorship to the current chair of orthopedics, Dr. Marcus.
Well, thank you, Dean Gersten, for inviting me to participate in this wonderful ceremony. Congratulations to Adonis and Nicole. I really enjoyed hearing about what's going on in your departments and your wonderful accomplishments. And also to James for assuming, as all three of you all are assuming, these very prestigious professorships here at Case Western Reserve University. Adonis, I had the privilege in 1975 of rotating on the urology service under Lester Persky, and we did make rounds at 4:30 in the morning, and he was an amazing professor. He really was a superb surgeon, a great clinician, and made even the lowly intern feel very special every day I was on the service. And Nicole, I knew Julius Mccall very well. I knew his family. I still know his son. And he had a reputation second to none as a brilliant banker and particularly as a man of incredible integrity. As far as Dr. Herndon goes, I trained under Dr. Herndon. He's the reason I came to Cleveland. He was, in 1953, appointed the 6th chief of orthopedics at Case Western Reserve University and at university hospitals. The department is now 114 years old. As Dr. Voos will tell you, if you look at Dr. Baumann, who was the chief in 1920, he started the orthopedic residency. And so in 1922, and next year we're celebrating 100 years of orthopedic training at Case Western and at university hospitals. Dr. Herndon was a very special person, an incredible role model. His contributions to orthopedics are second to none. He was president of the American Board of Orthopedic Surgery, president of the American Academy of Orthopedic Surgery, an associate editor of the Journal of Bone and Joint Surgery and Clinical Orthopedics and Related Research. During his unbelievable tenure from 1953 to 1982, he expanded our residency to 6 residents a year. He expanded the full-time faculty to 17 faculty members, and remarkably had 9 basic scientists in the department. He expanded our endowments, and he felt very strongly that that endowments for education and research should be at Case Western Reserve University, as that was the core of our academic department. Interestingly, he was a terrific surgeon and was invited to England to learn how to do hip replacements, and did the first total hip replacement in the state of Ohio. In those days, you had to have an FDA license to perform that operation. He was also the first actual chair of the Department of Orthopedics. Prior to 1978, we were a division, as were all the other surgical subspecialties of general surgery. And Dr. Herndon was then appointed the first chairman of orthopedics as a department. He retired in 1982, and based on his incredible impact in our field of orthopedic surgery, his former residents, former patients, and his colleagues raised the endowment, which he insisted to be at Case Western Reserve University, and that is the professorship we're here to celebrate today. So we're here to celebrate the inauguration of my good friend, James Voos, to this very prestigious position. James comes from Russell, Kansas, the home of Bob Dole and Arlen Spector. He was one of 3 kids that grew up in Russell, Kansas. There he is with his first Superman outfit. He went to the university, he went to high school in Kansas City and was a standout athlete. Here's a little newspaper clip from his exploits, Mr. Versatility for the Northwest football team. He then went to Drake University, where he played football and not only played on the varsity football team, but graduated at the top of his class, magna cum laude. He entered the University of Kansas School of Medicine, where he was president of AOA, graduated first in his class. And interestingly, on the first day of school, I heard the story firsthand, he met this cute colleague in his medical school class, and it was love at first sight, and they got married in their 3rd year of med school. From there, James went on to the Hospital for Special Surgery in New York, not only for residency, but they recruited him to stay on as a sports medicine fellow. He then did traveling fellowships in Zurich and in Bern, Switzerland. James was then recruited back to his hometown to join the Orthopedic and Sports Medicine Clinic of Kansas City. He was with them for 4 years, where he was one of the assistant team physicians for the Kansas City Chiefs and also took care of the Kansas City Ballet. January 2014, the Cleveland Browns and University Hospitals broke the silence that had been going on since October, and that they were going to take over after decades of the Cleveland Clinic running the sports medicine program for the Browns. This was going to be a new and improved situation with university hospitals partnering with the Cleveland Browns for their health care. My job was to recruit a top sports medicine physician to be the head team doctor. The Cleveland Browns felt very strongly that we needed someone with NFL experience to take over that job. That was important not only to the Browns, but it was also important to the league. And so I had to kiss a lot of frogs before I could find the right person. March 2nd, 2014, I think James and Kristen will probably remember a snowy day in Cleveland. I went out to pick him up at a hotel, which fortunately was right across the street from Ahuja Medical Center. And Kristen was going to get a tour of the area. And James and I spent which I thought was only going to be about a 15 to 20 minute time together. We spent a couple of hours talking about university hospitals, Case Western Reserve University. And I wanted to hear James's vision for sports medicine, which I was totally blown away with. I came home and told my wife, I've found the man. I've found the person to do this job. I then made a few phone calls, and I heard from my friend Scott Rodeo, who's at HSS and was one of the faculty members that trained James both in residency and as in fellowship. And I went back and looked at my notes, and this is a direct quote. He did a fabulous job, one of the very best fellows, and they've had some very good fellows there, fantastic surgical skills. I then actually had to ask his current partner about James, and this is a quote from a note I received from Chris Barnhouse, who's the head team physician at the Kansas City Chiefs. James has been a standout academically and professionally. He is a conscientious partner as anyone would want. And I think that university hospitals and Case Western have been very fortunate to recruit Dr. Voos. And I heard from many others, they were probably even more excited than James that he was coming to a big academic program because they felt this is someplace that James could really show his colors, and there was no end to what his achievements could be. So we recruited James, and in June of 2014, he became not only our head of sports medicine, but our head team physician for the Cleveland Browns. And no one was more relieved when James got here than me, because I didn't have to field the daily phone calls from the Cleveland Browns with tough questions such as what toothpaste they should use, et cetera, et cetera. Since James came to Cleveland, he has shown to be lived up to every one of the comments that I was told doing my due diligence. Within a couple of weeks of him coming here, I always like to go watch one of my new surgeons operate. And James did a complicated lateral meniscus repair on a young woman, cheerleader, who had a small knee, making it very hard. He was able to do it skin to skin during the entire time it took the operating room to turn over my room. Speaks a lot for James, and maybe says something about our turnover times. But in any event, he is clinically and technically an outstanding physician and surgeon. His research has expanded markedly. I think he has almost every one of our residents doing sports medicine research. He now has 82 peer-reviewed publications, 17 book chapters, and he's been invited to present his work on over 59 occasions. He has markedly expanded not only our sports medicine division, but also our entire department. And he is physically expanding our footprint. Anybody who have driven by Richmond Road and see what's going on at Ahuja Medical Center. He's literally turned university hospitals and Case Western sports medicine into one of the top places in the United States. We all know James from his appearances on the sidelines of the Browns games, but I will tell you what you may not know is he spends just about as much time on the sidelines of middle school and high school football and basketball and sports events and the Cleveland Marathon as he does with the Browns. He's there for kids and adults and amateur athletes. And I think the motto is from peewees to pros, and that's very true. James leads from the front and is willing to put his time in to whatever it takes to make our department the best. James has a fabulous family, 3 great kids. Some of you know the story that when he first moved to Cleveland, I found him a house next door to me, and got to know his wonderful kids and his lovely wife, Kristen, very well. And they're a terrific wife, a terrific family. And he's standing in front of his new house. He moved away and wanted to live right on the lake. I guess when you come from Kansas, the opportunity to live on a lake is very special. And he's hosted many department events at his beautiful new house right in Bracknell on the lake, which you can see in the background right here. So James, you are now the 10th chief of orthopedics. You're the 4th Herndon professor, with Dr. Heipel being the first, Dr. Goldberg second, and I was the 3rd. So congratulations. You have big shoes to fill, going back to Dr. Herndon, going back really all the way to Dudley Allen in 1907. And no one is happier than I am that you were chosen for this position. And the sky is the limit, and I look forward to supporting you over the coming years.
Thank you very much. I wanted to thank the School of Medicine and Dean Gerson for the opportunity to participate with this incredible group and chair ceremony. And before getting too far, I did also want to thank Kathy Malone for helping to set up all of the logistics for the event this evening. She's been wonderful, very gracious. Obviously, I've enjoyed working with her son here in our department, but I wanted to thank her for all of the logistics doing this here virtually. And also wanted to thank Adonis and congratulate Adonis and Nicole for their incredible awards here and recognition this evening, and certainly do not feel worthy of being in the same group as those two. They've been incredible colleagues and had amazing accomplishments. I did want to start by thanking Dr. Marcus, because he really is the sole reason we're here. I'm very humbled to serve in this role, in this chair here, as Dr. Marcus has been an incredible example. He's set the bar very high for both the clinical and academic expectations of our department, as well as truly being a gentleman and hosting department events at his home and nurturing the medical students, residents, and all of us faculty. Truly has been an incredible partner and colleague and confidant, and also incredibly honored to hold a chair with Dr. Herndon's name. It's been great as you learn more about the department's history. Dr. Herndon did his training at Hospital for Special Surgery in New York, of which we share similar lineage, so was humbled to follow in the footsteps of Dr. Herndon, Heipel, Goldberg, and Dr. Marcus. So very thrilled and very appreciative, Dr. Marcus, of the introduction here this evening. I wanted to start with this picture because this really is the team that day to day keeps us going here at university hospitals. And I didn't want to get too far without recognizing Mike Salata and Sean Cupp, who we spend hours and hours and hours together taking care of the Browns, both on and off the field, have been incredible colleagues and certainly couldn't do any of this without them, and are incredibly helpful both in their clinical acumen and research and education, as well as our hours spent on the sidelines here together. It's been great having Dr. Marcus support us as we came on in this role, so very appreciative. And then Jack Herrick, who is a very early supporter of us here in town, who I'm always very appreciative of his guidance. From my end, orthopedics really began here. We had a great experience working in the operating room, cleaning the floors and changing the sheets and changing out the anesthesia equipment at the surgery center my mother worked at. Really introduced me to medicine, and I really couldn't have thought of any other specialty to go into or any other occupation to go into, as this was essentially an apprenticeship for me. My mother and both the anesthesiologist who owned the surgery center ultimately at the age of 16 would allow me to start scrubbing surgeries in the morning. I'd mop the floors and do the laundry and all of those things in the morning, was able to scrub orthopedic surgery and plastic surgery in the afternoon, and then would finish the day cleaning up the rooms and getting them ready for the next day. So it was an incredible apprenticeship and really opened my eyes into orthopedics, and really appreciate my mother and father for the opportunity to do so. And it was a great opportunity to also see my mother, who's a nurse in healthcare, in action, and she's here watching this evening, so very appreciative of her guidance. This is my residency class here at the Hospital for Special Surgery, and I really owe where I am as a physician today to this group. I still talk to this group of orthopedic residents on a daily basis, and it's an institution of which really pushed us to excel and truly be physician scientists. Dr. Marcus was gracious to give you our pathway here to Cleveland. And this is what most of our day looks like outwardly, taking care of our professional athletes and standing on our high school sidelines. And certainly a big part of our job as a team physician. And it's really allowed us to stay at the top of our game, knowing what all of the latest and greatest treatments are. And now the opportunity to perform research that can affect the outcomes of our young athletes, and have been thrilled with the incredible faculty members we have within our department that have contributed to that. It certainly makes me look very good when we have such an incredible department and group of physicians. But I wanted to steer a different direction out of the clinical side of things and really take you on a quick path on my experience at Case Western Reserve University, the School of Medicine, and then the additional schools surrounding it. And I've been incredibly grateful. And this really all started at a cocktail party with Dr. Gerson and Hillard Lazarus, asking, do we want to use stem cells for musculoskeletal treatment? And just a quick conversation led to what's been a great research partnership and now led to an FDA-approved clinical trial, of which is the first in the United States to utilize stem cells or expanded stem cells for the treatment of musculoskeletal disorders. So this has been an amazing journey for myself, a sports medicine person who you visualize there standing on the grass, taking care of our athletes, really getting to intermix with an incredible group of basic scientists that I'm really humbled to be a part of this group. And as Adonis had mentioned before, Arnie Kaplan here on the left, who has been incredibly impactful in the field of mesenchymal stem cells. Tracy Bonfield, who's been an incredible partner, who we're working currently with all of the growth factors that these stem cells produce. Hillard Lazarus, who's now retired, was really the quarterback of this and really got us motivated. Although he was a Pittsburgh Steelers fan and let me know it every day, he was a wonderful, wonderful partner in terms of getting these projects off the ground. And Dr. Gerson, whose lab and his team with Jane Reese and others, I owe an incredible debt of gratitude that have really given us the opportunity to propel our specialty here using mesenchymal stem cells and partnering with the National Center for Regenerative Medicine. And I also wanted to thank in this setting Dr. Marcus, whose commitment to basic science and commitment to Case Western has led to the Randall Marcus Chair in Regenerative Medicine, of which we're actively recruiting now to further assist with this. It's really shown and really supported this in every single way to help to see us succeed. So I wanted to acknowledge Dr. Marcus again as well. So very quickly, without getting into too busy of slides, this is our whole stem cell project. We know you can take a single stem cell and the few growth factors they produce, which can give you some relief. And now, after harvesting those from the patient, expand those stem cells into the hundreds of thousands and therefore produce exponentially that many more growth factors and pro-growth cytokines that can ultimately improve healing for musculoskeletal disorders such as articular cartilage defects and early arthritis. And notably made this slide here prior to a big transaction with the Cleveland Browns. And so even with research, every now and then you get some growth factors and things that you may have not expected. But this clinical trial is ongoing. We've been thrilled with the results. And again, wanted to thank our partners at all of our partners throughout Case Western. And then steering another direction with Colin Drummond and Dhruv Seshadri. And Colin is in the engineering department, and Dhruv just completed his PhD. Colin approached me and said, I hear you're using wearable technology to monitor for injuries with the Browns. And we were the first team in the NFL to predict hamstring injuries utilizing wearable technology devices. We have since partnered together to continue to refine and develop these devices and have now published our 9th paper as a team together in advancing the use of wearable technology, first in professional athletes and now with all of our Case Western athletes, and will be one of the first groups to utilize motion and injury detection in youth athletes. And we're thrilled to be able to publish that and to be one of the first groups in the nation to be doing that. And finally, Claire Rimnak, who has been a stalwart in our department with Dr. Marcus and I in biomedical engineering, has been involved in every single aspect of orthopedic engineering and has been a great partner in many of our ACL studies, one of which one of our case medical students, Mark Majerion, has been an incredible contributor to, and Claire has been of absolute guidance to us in all aspects in our basic science program. So I really wanted to recognize all of our incredible scientists at Case Western who I would otherwise never have thought that we would interact together in cancer, in pulmonology, in cytology, in engineering. Has been an incredible opportunity. And I think it shows what a great partnership university hospitals and Case Western Reserve University have, ways that we would knocks down walls that allow us all to interact together and really help to move science forward. And for me, it's one of the most exciting things we could possibly do, to have this much of an opportunity to interact with such incredible other scientists. I wanted to acknowledge our department. It really is humbling, and I'm incredibly honored to represent our department. We have amazing orthopedic residents and medical students of which come through our department. Last year, we had 18 medical students match into orthopedics out of the Case Western Reserve University program. So we're thrilled to see them both match with us and across the country. Our department had 118 publications last year, of which was on every single one of them, and the Case Western Reserve University medical student was on 80 of those publications. So we couldn't do it without them. Incredible group of medical students who continue to drive us forward, amazing residents that it truly is an honor to be associated with, as well as recognizing our faculty that drive us forward here every day. I wanted to quickly conclude here with our acknowledging my family. On the left is my mother and father-in-law, Russ and Leslie Wismer, who have truly been my second parents, have taken incredible care of me and have seen us through very challenging times. So they've been wonderful folks. And we're thrilled they're actually here at our home evening. I wanted to acknowledge my mother, who's been an incredible support, and my father, who this winter will have passed away 20 years ago when I was in medical school at a very young age, and really is who drove me to be the person that I am, and am most grateful of all to him. I live my life by this. He received this award his senior year of high school, and these are the three things that I live my life with, and it's high physical fitness, good mental attitude, and high spiritual values. This is what we preach, and the mantra we have in our home, and really encourage all those we work with here with those similar thoughts. So I wanted to acknowledge my parents, and I have a brother and sister and their spouses, as well as my sister-in-law and her husband, and all of our nieces and nephews have been an incredible support group, particularly when we're on the road so much with the games. Finally, wanted to thank my amazing family. My wife, who is a physician, has been incredibly supporting throughout our entire career. Truly is my home team. And before every game, when we walk out on the field, we play mostly 1 o'clock games. Walking through the tunnel, I text this to my wife and family every single time, how much I love our home team. Truly wonderful. This is my hobby. I wish I golfed and did other things, and this is where we spend all of my free time here with our children, Callie, Casey, and Clara. And I wanted to acknowledge Clara here this evening. It's Clara's birthday tonight, and so she is sitting very patiently waiting to open her presents and blow out her candle. So I wanted to acknowledge Clara. And again, wanted to thank Kristen, who's been an incredible, both meeting in medical school, our first day, been an amazing support, a beautiful wife who has done more than I can ever imagine here to support our family. We again wanted to thank you for the opportunity to serve as the Charles Herndon Chair. Clara is here, wants to say hi here on her birthday here, so she's very appreciative here as well. And thank you, Dean Gerson, and to the School of Medicine for the opportunity to serve in this role.
Thank you. These have been absolutely remarkable presentations. I appreciate every one of them, and our leadership team at UH as faculty who introduced our recipients and their incredible choices of really quite amazing individuals. So I now get to move on to the fun part. I also want to comment on how often I hear the story, which happened to myself and my son, of meeting our future spouse's first day of medical school. So that's an amazing experience and keeps us all together. And happy birthday to the younger member of the Voos family. So as we mentioned at the beginning, endowed professorships are elite designation amongst educators, scientists, doctors, scholars. Wear that title proudly. We certainly respect the legitimacy and the importance and the legacy of these professorships. And they also represent incredible recognition with gratitude of the leadership, research, and contributions that each of you have made in your sphere. And I think this has just frankly been quite remarkable. Now, it is the case that actual chairs have been delivered, we hope, And with that, I would love to acknowledge our recognition of a real chair to the three recipients, Dr. Adonis Hijaz as the Les Kapersky, MD, Professor of Urology, to Dr. Nicole Maronian, MD, as the Julius W. Mccall, MD, Professor of Otolaryngology and Head and Neck Surgery, and to Dr. James Voos, MD, as the Charles H. Herndon, MD, Professor of Orthopedics. I would wish we were all in a room so we could all clap and make a lot of noise. You have to do that in your locale. And I hope that we can actually show off. It seems to me that we are. They're good chairs. They almost fit well. If Dr. Voos can change the design to make them more comfortable, he'll let us know. But I want to congratulate each of you and take good care of your chair. So if I could, again, if we were together, we'd raise a toast. I'll let you all get on to your evenings. And I want to thank Doctors Simon, Ponsky, Majerion, and Marcus for their wonderful introductions. And I think our three recipients, Adonis, Nicole, and James, feel the warmth and the glow of this evening and the respect that we have for each of you. Thank you and good evening.